Thank you. Dr. Rinaldo, you are now recognized.
Chairman Buchanan, Ranking Member Doggett, and distinguished members of the subcommittee, thank you very much for the opportunity to testify today. My name is Dr. Francesca Rinaldo. I'm a physician scientist with expertise in clinical research and healthcare delivery, and I'm the Chief Clinical Innovation Officer and Corporate Medical Director of SCAN Health Plan. I focus every day on improving the quality of life for vulnerable older adults. I began my career training in surgery at Stanford University. I observed that my older adult patients often experienced poorer outcomes, not only because of the high burden of chronic disease and functional impairment, but also due to insufficient support in addressing social determinants of health. Recognizing the need to address these critical factors to provide more comprehensive care for patients, I paused my surgical career. For 2 years as a postdoctoral research fellow at the Stanford Clinical Excellence Research Center, I focused on innovative ways to improve care delivery and outcomes for older adults by addressing the intersection between chronic disease and social determinants of health. I co-developed a high-value care model for late life, integrating the most effective solutions from both academia and industry. This model addresses factors such as social isolation, functional impairment, and loss of independence, while aligning the patient's health goals and values to the care that is delivered. After leading the clinical strategy for a national network of in-home caregivers, I took on my current role at SCAN, where I use my background to keep our members healthy and independent. SCAN Health Plan, one of the nation's largest nonprofit Medicare Advantage plans, serves nearly 280,000 older adults across 5 states. Almost 50 years ago, a group of older adult activists we affectionately call the 12 Angry Seniors were unable to access needed services. Frustrated, these seniors formed the mission-driven organization that became SCAN. In its infancy, SCAN was a network of services and programs such as meal delivery, home repair, medical centers, transportation, housing support, and more. To understand SCAN's origin is to understand our purpose today. In an industry dominated by large for-profit health plans, we believe that Medicare beneficiaries and taxpayers benefit from a robust presence of nonprofit plans. Our financial incentives center entirely around the beneficiary. Payments made to SCAN are directed towards high-value benefits and fair compensation to our providers. Nonprofit plans like SCAN are accountable to our communities, resulting in a better understanding of member needs and tangible investment in these communities. The results of this approach translate to high-quality care. For 11 years in a row, SCAN has received a rating of 4 stars or higher from CMS. Thanks to the flexibilities of Medicare Advantage, SCAN is incentivized to provide preventive care, which leads to fewer expensive and unnecessary acute care services like emergency department visits. For example, we reduce or remove cost sharing on high-value services like primary care and prescription drugs that keep chronic diseases in check. SCAN also strives to design benefits that emphasize wellness. One such benefit is meals and nutrition. We recognize that access to nutritious, culturally tailored meals, along with targeted nutritional counseling, is essential for managing chronic diseases. In 2023, SCAN delivered 41,000 meals per month under several programs we offer. These include post-acute meals, which provide delivered meals following a hospital stay, chronic condition meals, which are tailored both nutritionally and culturally to support chronic condition management, and long-term services and supports meals for our dual members, who are the most vulnerable in the communities we serve. Other examples of benefits to prevent disease are detailed in my written testimony. Congress has recognized that beneficiaries with chronic diseases face non-healthcare challenges by creating special supplemental benefits for the chronically ill. However, the chronically ill are not the only patients who face social risk factors. Low-income beneficiaries face similar challenges. To meet their need as well, SCAN believes that Congress should expand SSBCI eligibility to include dual-eligible beneficiaries, Part D low-income subsidy recipients, and other low-income beneficiaries, often referred to as the near poor, who face many of the same barriers as those living below the poverty line. Fortunately, legislation to make this change has been put forward. SCAN commends Representatives Blumenauer and Belarakis for introducing the Addressing Whole Health and Medicare Advantage Act. Congress should pass this bipartisan legislation as soon as possible. Thank you for examining this important topic today. SCAN's 12 angry seniors would be proud that the work they undertook 5 decades ago is being continued by this important committee. I look forward to taking your questions.
And